Hepatitis A is a naked RNA virus, non-enveloped, which makes it stable in the environment. It was previously classified among enteroviruses, but now it's recognized as its own genus, Heptovirus. There is only one serotype, which is why vaccination provides lifelong immunity. Four different genotypes exist, but genotype 1 causes the most human infection. This slide shows hepatitis A structure, and its lack of an envelope contributes to environmental stability, allowing survival in contaminated water sources. We can compare this to hepatitis B and C, which are enveloped, less environmentally stable, and require closer contact for transmission. Hepatitis A spreads primarily through fecal-oral transmission, and common scenarios include person-to-person contact, especially in daycare centers or even within households, and contaminated food or water. Shellfish specifically harvested from polluted water is a known risk. Bloodborne transmission is very rare, but can happen, and people who are IV drug users have a higher risk. After exposure, symptoms typically appear around 30 days later, so there is this delay between exposure and symptom presentation. The probability of jaundice will increase as age increases. Fewer than 10% of children under 6 become jaundice, whereas 70 to 80% of adults do. Most people recover fully, but some rare complications include fulminant hepatitis, cholestatic hepatitis, or even relapsing hepatitis. But it's important to note that hepatitis A itself never becomes chronic, and therefore our main goal for treatment is supportive care and supportive management. Acute hepatitis A infections diagnosed by detecting hepatitis A virus IgM antibody using EIA testing. Later, you'll see hepatitis A or HAV IgG antibodies that can indicate a past infection or immunity, either from prior infection or vaccination. Direct detection using PCR from stool does exist, but it's rarely used clinically. Hepatitis A is really challenging to grow in cell culture, so serology is what derives and drives a diagnosis. This graph is showing a typical timeline. Shortly after infection, we'll see fecal shedding will occur. We can see this here. Even before symptoms begin, this is kind of where our symptom course starts. And this explains why transmission often happens even before diagnosis. ALT, our liver enzyme, will rise with hepatocyte injury. Shortly after symptom onset, IgM, anti-HAV, which is anti-hepatitis A virus, will start to increase. So we see this IgM is going to increase and then go back down. And then eventually we'll see our IgM decline and our total anti-hepatitis A virus, which is primarily IgG, this antibody here, will persist, and this gives us that lifelong immunity. This is just showing months after exposure. Vaccination is the primary prevention strategy for hepatitis A. Universal childhood vaccination was recommended starting in 2006, and vaccination is also advised for adults at increased risk, so travelers to endemic areas, people with chronic liver disease, people with clotting disorders, and those at increased risk for STIs, as well as people who inject drugs. Good sanitation, clean water, and hygiene practices are also highly critical. We will talk about hepatitis B when we come back.